So I'm Dr. Ted Zuzelis. Thank you for coming to the seminar this evening. I'm a naturopathic doctor. A lot of you may not have heard of naturopathic doctors in the past, but we're specialized doctors of natural medicine. And so what that means is I'm not an MD. I'm also not an osteopathic doctor or a chiropractor. But naturopathic doctors, we attend 4-year naturopathic medical schools where we receive the same basic medical education like a medical doctor would, along with extensive training in different natural therapies so that we can help patients with natural medicines instead of drugs. Part of the reason why people in this area may not have heard much of naturopathic doctors is because there are only about 20 of us in the state right now. When I started my practice about 13 years ago, I was one of 2 doctors in the state. And a lot of that has to do with the fact that even though we go through 4 years of medical school and board exams and all that, we're only licensed in 17 states. In those states, we're primary care doctors, just like a regular medical doctor, only we do natural medicine. But in states like Ohio and Pennsylvania, we're not recognized yet, so that means that it's a lot harder for a lot of people to start practices, and people want to just be in those states where we can have a full scope of practice like we were trained. So we don't tend to get a lot of people into these states. So that's just sort of the basic background of naturopathic medicine. In my practice, with my patients, I tend to do a lot with diet, but also different vitamin supplements, herbs, and homeopathic remedies also to help people. And so we're going to talk about the blood type diet today. And this is a diet that I have been using with patients for the last 13 years. I've been actually on the diet for 15 years myself. And so before I start talking about the diet, I just want to talk about just general health and well-being. Way too much in our society, we're sort of programmed to think that health problems are something we don't have any control over. The doctor, all you can do is go to the doctor and they prescribe a drug, you take it, and that's the only thing you can do. And, even if you're healthy, all you can do is just sort of wait until something breaks. And then you go to the doctor to fix it. But things aren't like that necessarily. I mean, there are some things that are out of your control to different degrees, but there are a lot of things that you can do on your own to help yourself and to do things naturally so that your body can be healthier, and so you can help with different health problems or help to reduce your risk of getting different health problems. And so, like for instance, with our, the current state of our conventional medical care system, we have all this stuff going on with Obamacare, and I'm not going to talk about whether it's good or bad or anything. It doesn't, that's not the point. But, the point is that, we are having a problem in this country paying for health care. But when you look at the real numbers, about 75% of healthcare dollars are spent on chronic diseases, which are a lot of which can be, greatly reduced or eliminated with people just taking care of themselves. In fact, the CDC, put out some numbers that 80% of heart disease and 80% of type 2 diabetes, along with 40% of cancers, could be prevented if people did 3 things: exercise more, eat better, and avoid tobacco. And that's a lot that we can do to keep our, just on a personal level to keep yourself healthy. But if everybody in the country were to do that, you could cut about half of the budget out of our health care for our country. But we can't focus on everybody else because you don't have control of anybody else. It's really about working on taking care of yourself and realize that you're not a helpless bystander with your body's health. You do have control of things. Like I said, not everything do you have 100% full control over. I'm not about to tell you that I have all these miracle answers, but depending on what kind of health issues you have, there are a lot of things you can do to help better yourself. And so that's where we're going to talk about this blood type diet. So like I said, I was exposed to the diet about 15 years ago. I was halfway through medical school. I know I don't look like I'm 40 years old, but yes, I am. But in medical school, I was feeling, it was about halfway through, I was feeling pretty run down. But it's medical school, you expect that. But I was feeling a little more run down than what I felt like I should. So I went to my school's medical clinic, and one of the doctors there told me about this blood type diet, that I should really do this to help myself. And, I thought it sounded sort of hokey. I didn't really understand what your blood type and your blood had anything to do with the food you eat in your digestive tract. But I really respected this doctor and decided that I was going to give this a try. And so, I really started working on this blood type diet for a couple of months. And I'm actually a blood type B, which is sort of a rare blood type. We'll talk about more about that. But some of the things that I really had to work on for my blood type diet was staying away from wheat, corn, and chicken. And so that's what 90% of the typical American diet. But I was working on this diet really good and for a couple of months, and starting to see some results. But then my wife had a company picnic, and I decided that I had been so good with my diet for those couple of months that I was just going to go enjoy myself. I wasn't going to worry about eating ahead of time or packing some food for myself. And I found out that that was a bit of a mistake, because when I got there, the main food was subs from Subway, which, trying to do the best I could with the options I had, I got a turkey sub on a whole wheat bun. And after eating that sub, it took about 15 minutes. And after about 15 minutes of, after eating the sub, I felt so exhausted I could hardly keep my eyes open. I actually felt like I was drugged. And that was when I, had this aha moment. Okay, wheat is definitely a problem with me. I noticed after that, whenever I'd have wheat, that almost instantly I would get really severely fatigued. So being that at the time I was 25 and really didn't want to be held back by all of these, restrictions for my diet, I decided I had a wheat allergy and I just needed to watch out for the wheat and everything would be okay. And then, so that helped some, but I still wasn't, quite getting, back to where I felt like I needed to be with my energy. So I started looking at some of these other foods in the diet and playing around with them, and I found out that when I got rid of some of these foods for about a month or so, and then tried to add them back in, that when the things that I added back in that I was really having problems with, that I would notice it. So, like I said, as a type B, I need to stay away from corn too. So when I eliminated corn again and tried to add it back in, I found out that for me in particular, that it didn't necessarily cause that immediate fatigue like I noticed with wheat, but that over the next 24 hours or so, that I just didn't have the same stamina and energy that I would normally have. And so that's what, so those personal experiences is what made me, during medical school, be, real, interested in this blood type diet. And sort of spawned me on to doing a lot more research and understanding for myself. And then, of course, after graduating, looking and this diet and using it a lot with patients and really seeing a lot of good benefits. So I've been a real big proponent of this diet, like I said, for the last, in my practice for about 13 years now. So just to give you a basic idea of the underlying, I guess, importance of this diet. Like I said, when I first was exposed to the diet, my first impression was it sounded sort of silly because I didn't know what your blood type in your blood had anything to do with the food you eat in your digestive tract. But after I did a lot more research, I found out that interaction actually had to do with your immune system. So conventionally, we look at those blood type markers being little proteins on your blood cells that differentiate your blood from foreign blood. So if you were to get a blood transfusion of the wrong blood, your immune system would see those foreign blood type markers as foreign invaders and attack them just like it would a virus or bacteria. Of course, that can be dangerous. Well, our immune system in the digestive tract works essentially the same way. So that means that we can eat certain foods that have proteins on them called lectins that look like the other blood types. So when you eat those foods, your immune system, which is just looking for foreign invaders, will misidentify those foods as foreign, causing immune reactions there in the digestive tract, which then can work into problems elsewhere in the body. So I find that it's just a nice genetic marker to understand foods that your body are most susceptible to having a sensitivity to. And there's also certain foods based on your blood type that your body can really thrive on and do really well with. And so, with that, that gives you a little bit of understanding. And so for a long time, the first book on this blood type diet got released about '96, and didn't really, was mostly based on just a weight loss diet, which it really isn't a good way to propose. This is really a system of eating to be healthy. But they put out a weight loss book with not really much details as far as what's going on with it, underneath it. So on the surface, like I said, it sounds sort of silly, but over the years of looking into this more, you can actually see really the scientific basis even be talked about in conventional medicine, only they don't realize it. Like, for instance, the main conventional medical physiology book, guidance textbook of physiology, actually has a reference to this without, well, not a direct reference, but actually put it in the notes here. It talks about, for a long time, it was taught in physiology classes that, your blood type was something that was an immunity that you were born with against the other blood types. And it was pretty much the only one that was identified that way. Every other type of immunity was acquired. But now we found out that that's not true. And so, these immunologists and hematologists that are looking into that more have started to really realize that during the first few weeks of life, foods that you're exposed to and bacteria and viruses, in the digestive tract cause you to have immune reactions to the other blood types and cause you to develop, these immunity to the other blood types. And so they just unfortunately don't really acknowledge that that same reaction could be causing problems down the road also with other, with your foods. So, just want to then now talk about all of the different, the basics of the different blood types in the diet. If anybody has any questions, make sure to, sort of raise your hand and ask some questions. So the main, blood type, the most common blood type is blood type O. It's actually about 45% of the population. Second most common blood type is type A, which is 40%. So between the two of them, that's almost everybody, 85% of the population. And then you get to the blood type Bs, like myself, they're, fairly rare, about 11% of the population. And then type ABs are very rare, only 4% of the population. And so actually when you talk about, typically when people talk about blood type, you hear about, O positive or O negative or A positive, A negative. And that positive and negative doesn't actually make any difference when the diet's concerned. So if you're an O positive or an O negative, you're going to be looking at the same basic diet. So when we talk about blood type O's, like I said, they're the most common blood type. Type O's, some of the big problems that type O's tend to have tend to be with grains and dairy products. So, wheat and corn are the two grains that type O's tend to have the most trouble with. And most dairy products tend to be a big problem also. Where type O's tend to thrive tends to be a lot more in the meats and the vegetables. And so, a blood type O diet, you think more of like a, caveman diet or the paleo. Right now the paleo diet is out, it's very popular. And it falls a lot more towards that blood type O diet, restricting the grains, having lots of animal proteins along with, some fruits and vegetables and things, and nuts. And so that's, some of the basics of the blood type O diet. And then once I cover all the basic diets, then we'll talk about a little bit of, way to sort of pull this into, for your own diets. So then we get to the blood type A, which is 40% of the blood types, or 40% of the population. And type A's tend to be a bit different than the blood type O's. Where type O's tend to do really well with lots of animal proteins, type A's tend to be the opposite. They tend to have a lot more trouble digesting animal proteins, especially red meats. Now type A's do tend to do fairly fine with the poultry, chicken and turkey, And I definitely am not someone that's a real big proponent of people being vegetarian, because I just don't think that you can get the full complement of nutrients in your body real easily by being a vegetarian. So I do encourage my type A's to eat your chicken and turkey and fish. But type A's also have a lot of trouble with the dairy too, just like the blood type O's. And so that's another area that they really have to watch out for. In fact, my wife is a blood type A, and for a long time after I started the diet, she saw when I got rid of certain foods and tried to add back in the bad foods that I'd have reactions. So she didn't really want to get her blood typed. She didn't even want to know what she was. And it took a few years of feeling sort of lousy, and then she decided, okay, I'm ready to do whatever it takes to start feeling better. And so we got her blood type, found out she was a blood type A, and started her on this diet. So she, we really worked on staying away from the red meats and the dairy. And for type A's also, potatoes tend to be a big issue too. And so we did that, and she was starting to feel better. And then about a month after we started the diet, she started the diet, we had something happened, and she wanted to celebrate, and she wanted to go get an ice cream sundae. And so she had this ice cream sundae, and within 15 minutes of, within a couple of bites actually of starting to eat it, she went into this horrible sneezing attack. She had to throw the rest of the ice cream away, left the restaurant, and that was in probably about 2002, and she hasn't looked at ice cream since. Just because it wasn't worth it. In general, she's sort of my canary in the coal mine as far as dairy products. If it's something that's going to bother a blood type A, my wife's going to find it in certain foods. So that helps me to help other people too. She also, a little while later, she was still eating some occasional potatoes, and decided that she wanted to lose some weight, and she knew giving up the potatoes would be a good thing. And so she set a goal of a couple months, like 2 months after she was going to start this, that we were going to be going with some friends to Hershey Park in Pennsylvania. Figured she wanted to enjoy some park fries. Who doesn't love that? And so she was real good about eliminating the potatoes. And then we got to the park, and she got some of the park fries. And we're eating and stuff, and I wasn't really paying attention to her. I was looking at something, and she grabbed my arm, and she's like, "I can't breathe." And she was actually starting to have starting to have the beginnings of like an asthma attack. And she'd never had any problems like that before, but after she started eating potatoes, and that she started having that. But we didn't want to jump to conclusions. Thought maybe it was the park was dusty and different things. So on our way home the next day from the park, we were driving, and of course to Hershey, it's about a 5 or 6 hour drive or whatever it is. So we had to stop on the way home to get something to eat, and she decided she wanted to test it out again and have a couple of fries, and the same exact thing happened. So just another sort of enforcer for her that those are foods that she really needed to stay away from. Where for me as a blood type B, I tend to do pretty well with the dairy and the potatoes, and I give them up for any amount of time and add them back in, I have no trouble. And so, so this is just some of those different things that I see with patients. In fact, I guess another, a couple of other interesting, stories about, patients that I've had that had pretty remarkable results with this diet. I had a gentleman that came into my office, must have been probably close to 9 or 10 years ago, and he was in his late 50s. He had severe arthritis in his knees, to the point where he was actually just about ready to start, he was getting ready to consider knee replacement in both knees, because the arthritis was so bad, and none of the pain medications were even touching the pain. And so he came into my office, and talked to him, and he wasn't really willing to take any vitamin supplements and everything, but he was willing to do the diet for me, and he was a blood type O, and so he was willing to, we made some negotiations, and he was willing to do, stay away from wheat and dairy products for me. So I was real happy about that. And so he came back a month later, and he told me that his knee pain, his arthritis pains were totally gone. And I was sort of shocked at that. He said, well, they weren't totally gone. About a week ago I forgot and had a sandwich, and my knees hurt for a couple of days, and then they got better again. And so after that, I never heard from this guy. And then about a year ago, his son brought his girlfriend in, she was having some health issues. And so I found out who it was, and was asking him about his dad, and he's like, oh yeah, he's doing great. He's never had to get knee replacement. He's doing great as long as he stays on that diet and he doesn't have any knee pain. So it was like 8 years later that, he was still seeing those benefits. Another person that I want to talk something more specifically about someone here, but I had another person that I was doing one of these talks, not here, but it was an outside event, and afterwards, a gentleman came up to me and he said that he had psoriasis, and when he was having to use these different ointments and creams to keep it off of his forehead and eyes and stuff, and having a lot of trouble with it, and couldn't really get rid of it. It was really bothering him. And so I asked him what his blood type was, and he told me he was a blood type AB. And so I told type AB is the real rare blood type. And so I told him, typically type ABs, if they, the best things to really watch out for is staying away from chicken and corn and peppers. And wouldn't you know it, he came to another event a couple months later. In fact, him and his wife are normally here in the front row because he's never actually had a patient, but just giving him that, after about a month, his psoriasis was totally gone. You couldn't even see where it was, and that was probably a year and a half or 2 years ago. And he's doing amazing as long as he sticks on the diet. But back to talking about the different blood types. Like I said, type B, which I'm type B, is fairly rare. Type Bs, chicken, corn, and wheat tend to be, three of the big foods for type Bs. But also, things like peanuts and tomatoes, can be an issue too. And so, I've found a lot of benefits with that, and also with a lot of my other patients. But like I said, type Bs also, on the flip side, can do really well with dairy products and most of the vegetables and fruits. And they have a little bit, different. All the blood types have a little bit different mix of what works well with them. And then we get to the type ABs. Like I said, chicken, peppers, and corn tend to be some of the big issue foods for type ABs. And type ABs are actually more like the type A's as far as having a lot more trouble digesting the meats. So even though the type ABs, I really say that chicken is really the main one they need to stay away from. Red meats tend to be a bit of a problem for type ABs too, but if you have to sort of pick and choose, always want to stay away from the chicken versus the red meats. And so that's some it's a couple of basic things about these different blood types as far as their foods go. And it can be a daunting task to think about giving up some major ingredients out of your diet like wheat or corn or dairy products or things. But there are always good substitutes that we can do, things that we can switch out for. Like say for instance, if somebody has a lot of trouble with, have to stay away from the wheat. There are actually a whole complex of different, types of breads and things that you can look at. Like for instance, spelt is a grain very similar to wheat, but people don't tend to have allergy reactions to it like they would to wheat. And so you can find a lot of products in the health food stores that are made out of spelt that, with breads and pastas and flour tortillas and pretzels and cookies and all kinds of things that you can find at the health food store. In fact, we also have a spelt bread here that we get baked fresh from Great Harvest Bakery every week. That's really good. But there are also other types of breads that you can look at. Certain gluten-free breads, we'll talk about gluten in a second because that's definitely a different issue than just staying away from wheat. But some of the different gluten-free breads, can be good for the different blood types. It just depends on your blood type and the actual recipe, because when we're talking about wheat-free breads, because it doesn't have the gluten that makes it soft and pliable and stick together well, they have to do sort of a complex, almost a science experiment of different types of starches and grains and things to get it to work right. And so because of that, some of the other ingredients might not be necessarily the best for you. So you have to really look at the label and see, to find out what type of gluten-free breads might be good for you. But we have a couple here in the office that, we carry things here in the office that we can't, that my patients can't really find very easily at the health food stores or at the regular grocery store, so that, they have some options. So we have some of these things I might say that we have here, but you can't get elsewhere, but that's the only reason, because they're not carrying it at the health food store or the regular grocery store. But we have a couple of different breads made out of a grain called millet. And millet is a nice, gluten-free, grain that actually does really well with, making breads. And we have a couple of different ones. One that's millet, rice, and flax seeds. And then we have another one that's millet along with some different vegetables. It's, has zucchini and some carrot and some different things. And you wouldn't think that sounds like it would make a great, regular bread. You think of a zucchini bread like a sweet quick bread or something, but it actually is a nice recipe that makes a nice, regular sandwich bread. And then we also have a one that we just started getting in as an oat bran bread. And so typically, you'll see oat bran breads at the grocery store, but the first ingredient is always wheat. Or this one, it is just the oats and oat bran and stuff, and so it doesn't have the wheat, and it's actually a really nice texture. One of my favorite, as far as the breads right now. So that's one of the things you need to do if you need to get away from wheat. And so you can do like different pastas. They make spelt pasta. You can get a lot of rice pastas. So you can find good substitutes for some of these foods that you really like, just not so available when you're going out to eat to a restaurant. A lot of people, like I said, have to stay away from dairy products, especially the two main blood types, type O and A. And so when you're talking about, say, milk, you want to look at different things like soy milk or almond milk, which you can find in all the grocery stores now, and it's nice and easy available. But then, all of the blood types do, as far as dairy goes, do have certain cheeses that the cultures end up breaking down the milk proteins in a way that they tend to be able to digest them fairly well. So all the blood types do real well with mozzarella and feta cheese and farmer's cheese. Sheep's milk Romano, the Pecorino Romano tends to work pretty well with all the blood types. So even those blood types, like I said, don't do real well with dairy. They still have a couple of regular dairy products that they can tolerate okay. I'm trying to think of a couple of other main foods that I would want to talk about as far as substitutes. But those are a couple of the biggest ones. I mean, of course, there's always going to be little substitutions. Say, for instance, if you can't have chicken, you want to do, you can do turkey. You can actually get turkey, breast cutlets and cook them up similar to chicken at home, or you can do things like that, or just have, you can do more turkey, or you could do the beef or fish too. For like the type A's and the type ABs that can't have red meats, then you can look at more ground turkey, you can turkey burgers or turkey meatloaf or different things like that. You can get away from the red meats fairly easily. Just the sort of the take home here is that this diet is something that can be real beneficial for a lot of people, but you do need to give it a couple of good months to really eliminate those foods. I find that with some of the main foods that people need to get rid of, I usually tell my patients that you need to really look at some of those main ingredients and really be strict about getting rid of them for about a month or so, to give your body time to heal and have your immune system heal, so that when you try to add them back in, you'll be able to tell whether you're having a reaction or not. Because there's nothing worse than to do the diet, do a diet like this, and you're depriving yourself, and you're getting rid of a lot of the, say it's wheat, you're getting rid of a lot of the wheat, but you're having a piece of bread here or there, and but you've cut out most of it, but you're still not getting the benefits. So you're cheating yourself because you feel deprived, but then you're also not getting the benefits either. So it's nice to really fully get rid of some of those ingredients so that you can see that cause and effect when you add it back in and find out the ones that you really do need to watch out for, that you really do have issues with. And then, then that can help you to have a lot more full, varied diet without having to restrict quite as many different things. So some of the things that I find very commonly that this blood type diet helps for people. Pretty much any type of digestive, typical, your irritable bowel type digestive problems, or most, different types of digestive issues that people have, tend to benefit greatly with the blood type diet, and just by making these food changes. A lot of chronic sinusitis, I find, as you get rid of these food reactions in the digestive tract, it tends to help with, these sinus, issues, along with, migraines too, as far as the head. Like I said, some people, get some good benefits with joint inflammation and pain. Not everybody, so, as much as that gentleman I talked about with the knee arthritis, but I typically see a lot of improvement with, inflammation and pain. And just a variety of different health issues that we'll see improvements from, with different people. Well, thank you all for coming. I just want to let you know, if anybody does ever have any questions for me, specific health questions, if you're deciding whether you might want to come in for a visit, I do offer a free 15-minute phone consultation where you can talk to me about some of your different health issues, and we can talk about whether this might be a good route for you or not. Because I always want to make sure that people are ready and willing to put the effort in. It's going to be a good fit before they actually come into the office. All right. Well, thank you very much.
See you.